What is diazepam and what is it used for? Diazepam is in a class of medications called benzodiazepines. It works by calming abnormal overactivity in the brain. Diazepam is used to relieve anxiety and to control agitation caused by alcohol withdrawal. It is also used along with other medications to control muscle spasms and spasticity caused by certain neurological disorders such as cerebral palsy, condition that causes difficulty with movement and balance, paraplegia, inability to move parts of the body, athetosis, abnormal muscle contractions, and stiff man syndrome, a rare disorder with muscle rigidity and stiffness. Diazepam is also used along with other medications to control seizures. How to use diazepam? Diazepam comes as a tablet, a solution, and as a concentrate, liquid, to take by mouth. It is usually taken 1 to 4 times a day and may be taken with or without food. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take diazepam exactly as directed. Diazepam concentrate comes with a specially marked dropper for measuring the dose. Ask your pharmacist to show you how to use the dropper. Dilute the concentrate in water, juice, or carbonated beverages just before taking it. It also may be mixed with applesauce or pudding just before taking the dose. Stir the mixture gently for a few seconds. Take the entire mixture immediately, do not store it for future use. If you are taking diazepam along with other medications to control seizures, do not stop taking diazepam without talking to your doctor, even if you experience side effects such as unusual changes in behavior or mood. If you suddenly stop taking diazepam, your seizures may get worse. Your doctor will probably decrease your dose gradually. When to take diazepam? Before taking diazepam, tell your doctor and pharmacist if you are allergic to diazepam, alprazolam, Xanax, chlordiazepoxide, Librium, Inlibrax, clonazepam, Klonopin, chlorazepate, Genzine, Transine, Estazolam, Flurazepam, Lorazepam, Ativan, Oxazepam, Tomazepam, Restoril, Triazolam, Halcion, any other medications, or any of the ingredients in diazepam products. Tell your doctor and pharmacist what prescription and non-prescription medications, vitamins, and nutritional supplements you are taking. Be sure to mention any of the following: antihistamines, barbiturates such as phenobarbital, luminol, cimetidine, tagamet, digoxin, lanoxin, disulfiram, antibuse, fluoxetine, Prozac, fluvoxamine, Luvix, isoniazid, Lanezid, Inrifamate, Inrifator, ketoconazole, medications for anxiety, depression, mental illness, seizures, Parkinson's disease, asthma, colds, or allergies, metoprolol, Lopressor, Toprol-XL, monoamine oxidase, MAO, inhibitors including isocarboxazid, Marplan, linezolid, Xivox, methylene blue, phenelzine, Nardil, selegiline, Eldepril, Emsam, Zelaparm, and tranylcypromine, Parnate, muscle relaxants, phenothiazine medications for mental illness or nausea such as chlorpromazine, flufenazine, perchlorperazine, Compro, Procomp, and promethazine, Promethegan, omeprazole, Prilosec, probenecid, Probalin, Incalprobenecid, propranolol, Hemangiol, Indarol, Inipran, Ranitidine, Zantac, Rifampin, Rifadin, Rimactane, Inrifamate, Inrifator, sedatives, sleeping pills, theophylline, elixophyllin, Theo24, Theacron, tranquilizers, or valproic acid, Depakine. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if you have myasthenia gravis, a disorder of the nervous system that causes muscle weakness, sleep apnea, condition in which a person briefly stops breathing many times during the night, or lung or liver disease. Also, tell your doctor if you have narrow-angle glaucoma, a serious eye condition that may cause loss of vision. Your doctor will probably tell you not to take diazepam. Diazepam should not be used in infants younger than 6 months of age. Tell your doctor if you have or have ever had open-angle glaucoma, increase in internal eye pressure that damages the optic nerve, depression or other mental illness, seizures, or heart disease. Tell your doctor if you are pregnant or plan to become pregnant. If you become pregnant while taking diazepam, call your doctor immediately. Tell your doctor if you are breastfeeding. Do not breastfeed while you are taking diazepam. Talk to your doctor about the risks and benefits of taking diazepam if you are 65 years of age or older. Older adults should not usually take diazepam because it is not as safe as other medications that can be used to treat the same conditions. If you are having surgery, including dental surgery, tell the doctor or dentist that you are taking diazepam. You should know that this drug may make you drowsy. Do not drive a car or operate machinery until you know how this medication affects you. You should know that your mental health may change in unexpected ways and you may become suicidal, thinking about harming or killing yourself or planning or trying to do so, while you are taking diazepam for the treatment of epilepsy. A small number of adults and children 5 years of age and older, about 1 in 500 people, who took anticonvulsants such as diazepam to treat various conditions during clinical studies became suicidal during their treatment. Some of these people developed suicidal thoughts and behavior as early as 1 week after they started taking the medication. There is a risk that you may experience changes in your mental health if you take an anticonvulsant medication such as diazepam, but there may also be a risk that you will experience changes in your mental health if your condition is not treated. You and your doctor will decide whether the risks of taking an anticonvulsant medication are greater than the risks of not taking the medication. You, your family, or your caregiver should call your doctor right away if you experience any of the following symptoms: panic attacks, agitation or restlessness, new or worsening irritability, anxiety, or depression, acting on dangerous impulses, difficulty falling or staying asleep, aggressive, angry, or violent behavior, mania, frenzied, abnormally excited mood, talking or thinking about wanting to hurt yourself or end your life, withdrawing from friends and family, preoccupation with death and dying, giving away prized possessions, or any other unusual changes in behavior or mood. Be sure that your family or caregiver knows which symptoms may be serious so they can call the doctor if you are unable to seek treatment on your own. What should I do if I forget a dose? If you take several doses per day and miss a dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effects can diazepam cause? Diazepam may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Drowsiness, dizziness, tiredness, muscle weakness, headache, dry mouth, nausea, constipation, confusion, difficulty urinating, frequent urination, changes in sex drive or ability. Some side effects can be serious. If you experience any of these symptoms, call your doctor immediately or get emergency medical treatment. Loss of control of bodily movements, uncontrollable shaking of a part of the body, slurred speech, slowed breathing and heartbeat. Diazepam may cause other side effects. Call your doctor if you have any unusual problems while taking this medication.